Hi, and welcome to our bumper end of year show. For those of you who haven't joined us before, this is Mother Doctor Nurse. My name is Dr. Deb. I am a pediatrician and mum, and this is the wonderful Sarah Hunstead, registered pediatric nurse and founder of CPR Kids, and also a mum. We both have two girls. Today, we thought we'd add to the end of year chaos and craziness and go through as many questions as we can in rapid fire, answering the questions that you guys have submitted. So thank you so much for doing that. Yep. And we're going to get through what we can, right? This may be a longer live than normal. So stay on, let us know where you are. And obviously, if we do have time, we're very happy to answer any more questions. Just post them in the comments and we will get to them when we can. We're all revved up. Sarah, are you?
Okay, yep, I'm ready. I'm ready to answer all these questions. And thanks for the curly ones as well, by the way. A lot of people have brought us some really curly questions and we're like, oh, okay, no, this is good.
Exactly.
All right, so number one, okay. Do ambos ever meet you on your way to hospital? Can't imagine waiting at home. No, absolutely. So the quick answer to this one is that it depends on where you are. So if you live rurally, this could absolutely be a reality. So always what you need to do is not call the ambulance, always call 000, follow the operator's instructions. They will tell you what to do. And that is the most important part. So follow those directions. And if you are in a rural or remote area, then of course, knowing the way to get help. So it might not be calling 000, it might be getting on the UHF. There's a whole lot of ways that you can do that. Know what is in your area. Okay, next. Why does my child eat and drink well but gains weight so slowly? Deb, this is a Deb question if I've ever heard one.
Okay, so I think the way to look at this is, what about failure to thrive and why is your child not growing as anticipated? So the way that I look at it is I break it down into three things. One is they're either not getting enough calories, so what's going in. Two, they're using up all their calories. In other words, that's what's going on in their body. So maybe they have a chronic illness, something underlying that we're not yet aware of, or maybe they're not even absorbing their food. Or three, they're getting rid of things too quickly, and that's typically vomiting and diarrhea. So the third one is often quite easy to either include or exclude because it's pretty obvious. The other two need a little bit more investigation, whether that's just a really thorough history, going through exactly what your child is eating. And I must say that is by far the most common cause. The next one is, well, maybe your child is actually using up all of that energy. So here again, it's delving into your child's health, well-being, and a thorough physical examination. On top of all of that, your child may need some investigation. So I think that's often the easiest way to look at it under those umbrellas. In other words, number one, is your child just not getting enough calories? For example, are they getting a bowl of plain pasta versus a bowl of pasta with some olive oil and cheese and vegetables, or a bolognese on it or something like that? So that's number one. Number two is, are they using it up too quickly? And number three, are they losing it too quickly?
All right. Excellent. Thank you, Deb. So to let them sleep or not to let them sleep after a head bump, is it still recommended to wake them? So
Sarah, over to you.
I was just going to run with that one.
Yeah.
So the news is that, yes, you can absolutely let your child sleep afterwards, but. Okay, what we want to know is, after the head injury, are they back to normal? Are they behaving as they normally would? So you've got to know the red flags. So the red flags, are they vomiting after a head injury? Have they got abnormal behavior? Some really obvious stuff like, have they had a seizure or have they had a loss of consciousness? So all of these sorts of red flags that we're thinking about. And I will pop a resource for head injuries, which has got all of the red flags in the comments below afterwards as well. And of course, if after their head injury, don't put them straight to bed, keep them up for a little bit. You're feeling good that they're back to their normal selves, then absolutely, if it's nap time, you can absolutely let them have a sleep, but go in and check on them. Make sure that they're rousing. Do this, particularly if it's nighttime, do it until you go to bed. And if your gut is saying, yep, no, they're waking up well, I'm happy, they're back to normal, great. But if you're worried, then you're going to seek medical help. Okay, so
right.
Next question. When should I worry about a red spot on my baby's face? Deb, you with all of your newborn knowledge, let's go.
Okay, so it's really common for babies to have funny little spots and dots on them. I think it's important, first of all, always to seek help. So I would never expect a parent to be able to diagnose anything on their baby. But that being said, there are a lot of what we call newborn baby rashes and normal baby rashes. The most typical one I would see in terms of a red spot would be something with an awful name that is actually totally harmless and doesn't even bother your baby. And that's something called erythema toxicum. And that essentially looks like a little yellow pimple with a red base. And as I said, that is harmless. But it's also important to be able to recognize the ones that need urgent review. And here what I'm talking about is blanching versus non-blanching. So we all worry about the non-blanching rashes. And what that essentially means is a rash that does not fade with pressure on it. We've done other videos on this before, and maybe we can also link to that. But essentially, this is a rash where if you press on it or roll a glass over the top of it, it does not fade. The indication of that not fading implies that there's a problem with bleeding and possibly sepsis, and this needs urgent review. All the other funny dots and spots and little rashes that newborns get, or even birthmarks that newborns get, are obviously less concerning and less dangerous, but certainly run them by your own doctor.
Yep, perfect. I think that's key there. Always seek the medical help when you are in doubt. All right, next up, can you use claratyne? So this is an antihistamine for allergies for a 1-year-old. When do you need to see a doctor? Deb?
Okay. Look, I think the way to answer this question is, well, what are the signs of anaphylaxis? When do you need to seek urgent medical care? Because allergies kind of encompasses a whole lot of things. I'm guessing, looking at this question, that we're talking more hay fever, but I'm not so sure. So allergies could be a food allergy, could be a contact allergy, could be inhaled allergy, could be hay fever, all of these things. So what are the signs of anaphylaxis? A rash may or may not be present. I am going to mention it first because often it is the first thing that a parent will notice, but it may or may not be present. Your child may be vomiting. Your child may have significant abdominal pain. Your child may have difficulty breathing. They may suddenly develop a cough. Their voice may change. They can start vomiting profusely, or they can even become drowsy and lose consciousness. So there's a huge realm of very serious symptoms that can indicate a significant allergy. So I just wanted to mention that up front, just for safety reasons. Putting that aside, if we're looking at claratyne as an antihistamine, and there are lots of different antihistamines, I think I first want to mention, claratyne just happens to be one of the brand names we have here in Australia, and I think maybe in Canada too. But anyway, so the question is can you use antihistamines in children? The answer is yes. For the younger age group, though, we do have a caution over antihistamines, and those are usually the more sedating ones because of the potential dangers of them. So my recommendation is, one, first of all, determine if your child's symptoms definitely are an allergy. Two, is that a potentially serious allergy? And then 3, would antihistamines help? And then 4, which one is the right one for your child and at what dose? So those questions should be guided by a healthcare provider.
Okay, excellent. Thank you, Deb. Now, everybody can relate to this question right now. Everybody out there. It feels like my 2-year-old has a constant snotty nose. How long is too long for a snotty nose? I feel like that with my teenager at the moment as well. But that's okay. Deb, tell us, how long is too long?
I think we've just spoken a little bit about allergies, and which brings me to the point of, well, why does your child have a snotty nose, and is it really constant? Addressing the second question first, it's very common for children to have what feels like back-to-back colds and a constant runny nose. But if you actually analyze it, you will actually say, oh, well, actually, there were a few days when I wasn't blowing their nose as much, or they didn't have that green snot dripping down, they were licking.
Yeah.
That's so gross, but they all do it. Yeah, and then it came back again, and that is often the pattern we see in those preschoolers who are getting those frequent upper respiratory tract infections that are very, very common and usually, entirely normal part of childhood. So first of all, we need to determine that. If it truly is constant, then, my next question is always, well, is there anything, what exactly does that snot look like, and what exactly is the pattern to it? Is it worse in the mornings? Is it worse during the day? Just trying to work out exactly what the cause could be. So I guess, constant runny nose, what could the cause be? Allergies is definitely up there, especially if it is a constant clear snot versus that thick mucousy looking snot. The other cause could be, especially if it's just in one nostril, the question is always, is there a foreign body there? Could your child have stuck something up their nose, not your nose? Hopefully you'd notice that. But that's the classic thing that we get taught about, isn't it, Sarah? Unilateral. So in other words, one side, constant snotty nose, and usually that's actually a purulent looking snot, so like that thicker yellow green snot. There's probably a foreign body up there. Yeah, exactly. But there can be other things, in terms of, that's causing chronic inflammation, polyps. It could even be reflux that's causing chronic inflammation and a snotty nose. So definitely, I think it's something worthwhile looking at if it's truly, that constant snot.
Yep. Okay. Oh, okay. I'm feeling mildly nauseous now talking about snot. It's the one thing that gets me, but that's okay. I have vomit over snot any day. Thank you very much. So next. Oh, no. Anyway.
Why don't you take this one, Sarah?
Okay, good. I'd rather vomit than snot.
Okay, I'll read out the question. Best advice for a 1-year-old with gastro that is refusing water.
Okay, so first of all, one good thing is that there are lots of alternatives out there that are really good for kids who are losing from vomiting and diarrhea. So we want to replace not just the water, but we want to replace the electrolytes, so the salts and sugars that are there too. So keep stock in your fridge or your freezer some of the oral rehydration solutions. So you go to your pharmacy, have a chat with your pharmacist and find out what's best for them. They sell them in the supermarket too. And I often think that putting the ice blocks in the freezer are a great thing to do. Whether or not your 1-year-old is into ice blocks or not, you can certainly try. But the key here is small, frequent amounts of fluid, and just try the different flavors as well. There's lots of different ones out there. See what they like, and the aim is small, frequent amounts frequently. If they are breastfed, then absolutely small, frequent breastfeeds are wonderful. And of course, what I will be doing is, Deb, do you have a resource on this? I bet you do.
On what, gastro?
No, I know you would on gastro, but particularly about rehydration solutions.
I don't actually have one on rehydration solutions, Sarah. You
That's
called me out here.
No, well, now I've given you something that you need to do, because you've got everything.
Thanks. Something else.
Yeah, something else that you're going to need to do now. But what I will do is actually put a fact sheet in the comments below on this specifically. And the other thing to do is that, just remembering we want to make sure that they are being hydrated. So small, frequent amounts. And I will put a fact sheet down that also tells you about how much according to your child's needs or their age and their weight of what you need to be getting into them. So
absolutely, I think, Sarah, I think absolutely, just to say what you're saying is that water actually isn't the ideal fluid for children. And then secondly, it's about using one of those oral rehydration fluids. But, the bottom line is some kids just don't like the flavors, and you got to work with it, whether it's ice blocks, whether it is actually using a water, with a splash of some kind of juice, just to give them, something for them to start drinking, while you seek medical care.
Yeah, absolutely. And also, I know we've talked about a 1-year-old here, but under the age of 6 months, if your child has got diarrhea and vomiting, you need to seek medical help. Really important.
100%.
So next,
I feel like we have a lot to say on that topic, and we've definitely done a live on it before, so maybe we'll link to that as well, because I feel like there's so much more we both want to share.
I'm holding back here. I am really holding back.
I know, I can see.
I really am. But
here's another one for you, Sarah.
I tell you what, I love
How does
talking about.
one remove remaining jellyfish tentacles without getting stung?
So
For
the
that
answer
person from Boise, Idaho, I'm not sure if this is a problem you ever encounter, but perhaps if you come and visit us here in Australia.
exactly, you'll need to know. Okay, first of all, the answer is carefully. I will elaborate a little bit more. So it depends on where you are as well. So obviously, if you are in tropical waters, okay, so you are in tropical waters, you will know, and if you are traveling, you need to know what jellyfish are in the area you are going to, such as the box, the irriganges, all the rest of it. Then you are flushing with copious amounts of vinegar and then carefully removing any leftover tentacles. Now, the guidelines say with gloved hands or tweezers. I don't know about you. I don't tend to go to the beach with gloves or tweezers personally. So
Or
ideally,
vinegar.
no, but the good thing is when you are in an area
Yeah.
that has these, you will see those bottles of vinegar that are often along the beaches. They are there for this specific purpose. So that is a good thing, that often you will find that there is vinegar available. So flush with copious amounts of vinegar, and then you can do things like I've seen somebody wrapping their hand in their beach towel and flicking the stings off, which is a brilliant idea. Using whatever you've got to be able to remove those stings without being a victim yourself. Now, the other thing is in non-tropical waters, when we are talking about blue bottle jellyfish, so that's the Portuguese man of war, we are not flushing with vinegar first. We are using copious amounts of seawater to flush these stingers off. So with anything that's left, now, there is something circulating around at the moment that says get handfuls of sand and rub the tentacles off. Please don't do that. That will cause significant irritation. What you then need to do is simply do the same thing, flick them off, use a towel, do that, but without rubbing them into the skin. I have used my fingers to pick off the little bits of, blue bottle jellyfish stings. I didn't really feel anything on my fingers. If it was an extensive sting, I wouldn't have done that. It was just a tiny little bit there. So that's one of the important things, is you're going to do it carefully and know where you are. Super, super important. Okay, next. Probiotics and
Yeah,
multivitamins.
this one's for me.
It's a dead one.
Probiotics and multivitamins, are they worth it, and do they prevent illness? Look, it's $1 billion industry, right? So there must be some truth behind it, one would think. Look, my approach to preventing sickness is, well, one, there's a degree of what's normal, and it is normal for children to have around about 8 to 10 simple viral upper respiratory tract infections a year. That being said, I always delineate between children who recover well from them and quite quickly, and children who get really sick from it. So I think children who are getting really sick from these infections, even if they're falling within the normal number, there is some support we can perhaps give them. So can you prevent illness in children? I'm talking slowly because I think it's a very tricky area to talk about. We talk about boosting immunity, and is it even possible, and what's the science behind it? And I look at it from a holistic perspective, and I do actually think there are things we can do to help support our children better. For example, we know that zinc and vitamin D are imperative to our children's immune system. We know that good nutrition, we know that good sleep. I mean, how many of us who go through a stint of not sleeping well, and then suddenly we get sick? It's about being run down. So, it's really about looking at your child as a whole. Are they eating a healthy diet? If they are, they can probably get all of their nutrients actually through their diet.
Yep.
If they're not, then maybe they do need some supplements. So I've mentioned a couple of the vitamins. The whole vitamin C debate is still out there. There's some evidence for it. There certainly seems to be strong evidence for vitamin D. And then the whole beautiful world of gut health and the microbiome comes into play. And there's a lot of different studies out there, a lot of different literature. And I can't go into all the details of it. So I really, as a quick snapshot answer, my answer would be, it's about lifelong health that actually promotes immunity. And lifelong health is that holistic approach that I'm talking about. But if you do think your child needs supplements, those over-the-counter gummies and multis and things, they've got a small dose that's certainly safe. But if you if you think your child is really not getting the nutrients they need, then they may need some medical assessment, investigations, etc., to make sure that they're not deficient and actually needing replacement, as opposed to just the small doses that multivitamins can give. So I don't know if I've answered that question quite, but I think it is a specific, quite detailed question.
Yep, no, absolutely. And I think one thing that I've learned from you, Deb, in the years we've been doing this now, is that when it comes to supplements, that in kids they really need to not be self-prescribed by parents, that you really need to be doing that in partnership with a healthcare professional. And that's a really important thing that I've learned from you, Deb. So thank you. Next question. It's another Deb one. Yeah. And the dogs are with that as well. How long is too long for a cough to last? How long is too long?
Okay, it's kind of the same answers as the snot question. Is it really chronic, or is it coming and going? So that's the first thing. The next thing to note is the pattern of it. There's certain coughs that'll indicate to me as a doctor, could this be from hay fever? Could this be from asthma? Could this be from reflux? There are lots and lots of causes on cough, and I certainly do have some resources on my Instagram about this, so please go ahead and follow me there. So the general definition of a true chronic cough is over a month. But it really depends on what else is going on for your child and how sick they are with it, when it's happening in the day, what it sounds like, and what the examination is like. So, if your child does have a lingering cough, it certainly is worthwhile seeking review, medical review, that is.
Yep, excellent. So next, we've gone from coughs to another long-term thing. Contagiosum.
Oh, it's such a frustration, I guess, molluscum. I don't know what else to call it, because typically speaking, it doesn't cause a lot of distress to your child. It can be itchy, it can be infected, but often it's just a cosmetic concern. So I think the bottom line is it's really common. It's really common for it to be long-term. But usually the body eventually rids itself of it. There are lots of remedies out there, and we've definitely done a live on this, and 100% roll this one. So Sarah's making a note of the things to link, and I've gone through different treatment options there. So I think let's rather just link to that. But other than to say, long term, you can still go through all those different treatment options. Sometimes they actually end up right at the end where they're needing the immunotherapy, under the care of a dermatologist.
Okay.
Or sometimes they're scooped out, but curettage scooped out, but that is quite a radical treatment, and it's reserved for certain children. And it's right at the end. It's not something that we do in the beginning.
Okay, very good. All right. Ooh, controversy. Here we go. Oh, I like this.
I don't know who should answer this one.
Oh, this is yours, Deb. Why do doctors love handing out antibiotics like lollies for viral infections? Deb.
It's a bugbear of mine. Look, I don't want to get myself into sticky water with any of my colleagues, but it's a fact. It's a well-known fact that antibiotics are overprescribed. And what are they overprescribed for? They're prescribed for viruses, which is totally inappropriate. Antibiotics do not kill viruses. Antibiotics kill bacteria. So why do people do it? I can't answer that question. I don't know what their thought process is. I think all we can do is empower parents to, first of all, have the knowledge as to when it's more likely to be bacterial, but then most importantly, to ask their doctor and question their doctor. And if you're not 100% happy, seek another opinion. I don't think that it should just be, I'll just give another course of antibiotics. We know that there are risks to antibiotics, whether that's something as simple as, the poos just being a little bit looser, to actually significant chronic diarrhea. I mean, it usually does happen in older people, but, you can get something called C. diff, where you can get really intractable diarrhea and significant health problems, from chronic antibiotic use. But my concern is the impact on the microbiome, and then we also have the concern of antibiotic resistance, because if we're using antibiotics like our lolly water, then our children are being overexposed to them, and then there's the risk that when they actually do need them for a bacterial infection, they will not work. So, I don't know what else to say on that topic, Sarah.
I think, I agree. I think there is absolutely a place that children who need antibiotics should be prescribed antibiotics, and those
100%.
with infections. Yeah, exactly. So I love what you've said there about asking the why. I think that's really, really important. Okay, moving on, because we could talk about that one for a while as well. Oh, constant teething and sickness. Is the pain relief too much over time? So what we're presuming from this question is paracetamol and ibuprofen use for constant teething and sickness, because with those back-to-back coughs and colds, how much is too much, Deb?
Or acetaminophen for our North American listeners. And for those of you who do know me and follow me know that I'm not a huge fan of pain relief or antipyretics, so using these medications for pain or fever unless they're really needed. So that being said, some children are in extreme distress with teething. Thankfully, I had 2 children who it just didn't bother them, and there are also other remedies you can try before trying medication, but there's side effects. Again, every medication, every pharmaceutical drug has a potential side effect. We know that. It's in the literature. It's actually in the pamphlet, in the box that you buy. And, so is the pain relief too much over time? Look, there's the risk of overdose. There's the risk of kidney issues and gastric issues with ibuprofen. Ibuprofen also impacts the gut microbiome. So yes, I do actually think if they're misused, that there is potential for long-term impact.
Yeah. So the important things here are absolutely following the directions on the bottle. It clearly says that there is a time frame that you are able to do that. The important thing is that if you are thinking that you're going to need to exceed that for whatever reason, it's got to be under the guidance of your doctor, who can take all of this that Deb's just been talking about into account, and of course assist your child to be pain-free, because we don't want our children to be in pain.
Yeah.
That's the really important thing. So we absolutely don't want our kids in pain. However, it's got to be under the guidance of a healthcare professional if you are going outside what it is saying on the packaging. There is a really good resource as well called Medicine Wise, and you can ring them and ask them for acute advice like this, but ongoing management of pain and sickness needs to be from your healthcare professional, so your GP or your paediatrician. Okay, and I will put the resource to Medicine Wise in the comments below as well. Oh, I think this one.
Okay, one for you, Sarah.
Mm-hmm.
Is the ambulance availability situation getting any better? What do you do if no ambulance is available?
Oh, this is such a tricky question, because you know at the end of the day you don't want to be doing CPR in the back of a car. You want that good effective CPR if needed. You don't want to be driving to hospital and your child is having a seizure in the back. There are all of these factors that we need to think about. And so is the ambulance availability situation getting better? It depends on where you are. It goes up and down. Certainly when there's a whole lot of people off because of COVID, it becomes worse. When you've got fully staffed, it's better. So of course there are lots of things that impact that. What's really, really important is that you don't just go, okay, I'm not even going to bother calling. Please call 000. The operator is able to guide you with what you need to do. And I think that's a really important thing. And also knowing first aid. Knowing what to do in those minutes before an ambulance can get there is invaluable. If your child is burned, being able to give good effective cooling on that burn while you wait for an ambulance will make the difference in the outcome of their skin. So it's really important that you know what to do. Still call 000. Please follow their instructions. Okay, so that's really, really important. It's hard. I don't have a definitive answer, but I don't want you to not call, if that makes sense. Please call and please follow their instruction. All right.
And do one of Sarah's courses, because you will definitely
know
be
what to
able to fill that gap waiting for the ambulance.
Exactly. That's exactly right. So be able to fill that gap. Thank you, Deb. I love it. Very good. Okay. So now we have another Deb question, because Deb is the eczema queen. What is the best non-steroidal treatment for eczema in babies?
Moisturizing. I think that's all I need to say. Look, exactly. Moisture, 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 moisture. So we need to help seal in the moisture into your child's skin, and that's with a simple cream. Nothing fancy, nothing fragrance, preferably nothing with foodstuffs in it, like almond oils and things like that, because the potential risk of sensitizing your child to later developed food allergies. But yes, just lots of moisturizing, and then working out anything that could potentially be causing it, aggravating it, and removing that.
Perfect. Short and sweet, Deb. I love it. Excellent. Okay, so here we go. How high? Can I take this one, Deb? All right. So how high should
we're itching, both of us itching to go at this one.
I know. We're like, okay. Should the fever be until I give ibuprofen, paracetamol? Okay. I'm going to be very controversial here, because I know that we really want to focus on the number when our kid's got a fever, but it's not about the number. It's about looking at our child. Are they in pain? Are they refusing to drink? Are they absolutely miserable? We only give ibuprofen or paracetamol for comfort only. It's not about reducing that temperature, because remember, fever is the body's natural defense mechanism. It's controlled by the brain. It is not, children don't get, one of the biggest fears out there is your child getting brain damage from, a high fever. That's not going to happen from the fever. It is the body's natural defense mechanism to try and kill that virus or bacteria that's causing the illness. So remember, fever is not the illness. We don't have to bring that down. We just have to make them feel comfortable. What can we do? Cooling them, so just keeping them in a layer of nice, cool, breathable material. We're not needing to put them in a cold bath or actively fan them or anything like that. It's just about keeping them in a nice, cool environment, not rugging them up too much. And if they are in pain or extremely miserable, we can give them ibuprofen or paracetamol for comfort only. And it's about, of course, if your child is under the age of 3 months, we are seeking medical help. And if you're worried about your child, if they've got any of the other red flags that we talk about, which I will pop a resource for, because we could talk about red flags for ages, of course, we are absolutely going to seek medical help. And Deb, anything you want to add to that?
Nope, totally agree.
All right, then. Next.
Another one for Sarah. I know you've done a lot with sepsis.
Yeah. Info and symptoms for sepsis and pneumococcal. I'm not going to answer this now. I am going to post below the videos that we did with the Queensland Children's Hospital, or is it Children's Hospital Queensland? I'm terribly sorry. I should know that. I've got your name backwards. I'm so sorry. But we did a whole series on kids and sepsis with the incredible sepsis team there. So I'm going to post that below. It's brilliant. I need to say nothing else. Deb, your turn. Teething.
Can teething really cause diarrhea, fever, runny nose? False? Nope. True. We don't really know why, but it's thought to be the associated inflammation you get in the gums with teething. So it's very, very common for their poos to suddenly get sloppy, for them to maybe get a rash on their cheeks, for them to get a low-grade fever. I remember being taught in medical school that they do not get a fever, yet every single parent will tell you they do get a fever. But the importance is that it's a low-grade one. What's a low-grade fever? Anything around about 38 degrees. Once it starts climbing higher to 39 degrees, I personally think that it's worth, it's not just from their teeth. There's most likely something else going on. And the same thing for a runny nose and diarrhea. It's got to be in the context of how severe it is, and are there any other symptoms going along? Because diarrhea, fever, and runny nose can all happen with a viral infection, like something like adenovirus typically could cause both. So it is really important to look at how mild the symptoms are, and for the more severe symptoms, let's look deeper and let's work out what exactly is going on.
Yep. Okay, great advice. Thank you, Deb. Thanks for, busting that myth. Or no, I think I just said the wrong thing then. Let's move on. Anyway,
we're getting tongue-tied.
Best way to get a toddler ready for a blood test. How do we hold them? So first of all, preparation, and preparation.
Yeah.
Truth telling. That is the most important thing that you can do, is tell them the truth about what's going to happen. Do not lie to them. And that's so important. So role playing, okay? You can role play with them. You can take them to the place they are going to have the blood, so it is familiar to them. Often places, if you ring up and say, my child has to have a blood test, can we just come in, and so they can see the room that's going to happen. There are so many resources on the Royal Children's Hospital website and also the Sydney Children's Hospital website. There are videos that you can watch about a whole lot of medical procedures, including blood tests. Being able to give them some choice about things. So the choice isn't about having the blood test, but the choice may be, what teddy do they want to take with them? What sticker do they want to choose afterwards? So giving them some control, but obviously not about whether or not they're going to have the test. Explain to them what's going to happen. You can use EMLA as well, or a topical anesthetic. You can get that from the chemist, and that can numb the skin over the top as well, so that can be helpful. And also, allowing them to do things like play with some of the equipment. Obviously not the needle, but even asking the person beforehand. I know when my daughter had to have a blood test for the first time when she was 3, the lady who was doing it was fantastic. She handed her the tourniquet and said, have a look at this. So she got to feel it. She got to feel the Band-Aid. She got to feel the swab that they were going to wipe on the skin. So it took the unknown out of it. And I think that's a really, really important thing. I could talk about this for, I reckon, 45 minutes. So, but what I will do is I will put the resources down below, because I have to keep it short, even though I want to do a whole Facebook Live on this, because there's so much we can do. Medical play is so important. Let me just write it on the list of the resources.
And while you're writing, I'll just add 2 more things. One, iPhones. I think that screen time is absolutely called for during blood tests.
Yes.
Because that's a great distraction technique, and Sarah definitely that'll be in the link that she shares, all about distraction techniques. And then the other thing is, as a parent, just keep calm about it, because what you don't want is your anxiety to spill over to your child, because I promise you they pick up on it. They're like animals, they pick up on our stress, and it makes it harder for them. So if you are as the caregivers, listen to it. If you are the person that doesn't like needles, that's scared of blood tests, get someone else involved. Get someone else to come to help with the child who's going to be calmer, because I promise you it impacts.
Yep, absolutely. And I don't have a mannequin with me to show you about holding, but it is in the resources. And so we're giving them a nice cuddle. And that's really, really important as well. We're holding them in a way where we're not allowing the wiggle, but we're doing it in a comforting way. Okay. And that's really important.
Yeah. And going to a place that's good with kids. And you just made me think of that, doing that, because a place that's good with kids knows all of these things as well. And they're experienced with kids, and they're also experienced with the actual anatomy. We've all got the same blood vessels, but the sizes of everything. So, yeah.
Exactly. Ring first to find out if they do.
Clearly we've got a lot to say about this topic.
We do. I could just keep going and going. There's so much that you can do. Okay. No more for now. Lots of resources.
Is this our last one, or did we come up with 22 for year 2022?
No, we've got 21 here, but we do have other questions in the comments too, which we may be able to get to.
We thought we'd make it fun, 22 for year 2022.
Yeah, I think I left one out by accident, so I'm sorry if you didn't.
I think I did. It was an unusual one here.
All right. This is you, Deb.
This is for me. And keratin. In Canada, the ferritin levels are considered the normal range if they're blah. However, I'd like to know what would be the optimal range. Okay, so ferritin, for those of you who don't know, actually indicates your child's iron stores in their body. So when we look at iron levels and iron deficiency, there are a few parameters we look at, including the free iron floating around, how saturated the cells are with iron, but possibly most importantly, the iron stores, the ferritin. So different labs in different countries quite clearly have different ranges. Yep. In my books, even if 14 to 101 micrograms per liter is reported as normal in Canada, to me 15 is not normal. So and the same here, the most labs in Australia will report 20 to 150 or 20 to 200. And I always say to families, I never see children close to 200, but to me, 21 is still not normal, but it's just too low. So the short answer for a very long ramble that I'm giving you is I like to aim for a ferritin of around about 50 to 70. And that's often based on optimal levels that I've had in conversation with sleep physicians and other practitioners as well. So, I think it's important to acknowledge that just one above the bottom level of normal when you've got such a massive range is often not quite enough for children who are growing and have massive demands on iron, for their bodies. I think there's something else I was going to say, and I've just promptly forgotten it. So I apologize. It will come to me in a second. What was I going to say? Sorry, Sarah, did you hear me?
No. Sorry, you just dropped my end for just a second.
That's okay. I think I'm a bit boring at times too. I also wouldn't listen to me.
No. All good,
I tend to waffle. No, I was just saying there was something else I was going to say. The other thing I was going to say is the ferritin is a funny blood test because it can actually be falsely elevated. So if your child has to have an iron level test, make sure they don't have an intercurrent infection, like a viral infection, snotty nose, cough, because ferritin is something that's called an acute phase reactant, which essentially means when your body has any kind of inflammation in it, it rises. So it then becomes incredibly difficult to interpret in the context of iron deficiency. So do a blood level when they are well.
Yep, fantastic. Thank you very much, Deb. Now, we've been going on for about 42 minutes now, which is a really long time. We do have some other questions that are on here, but what I'm going to do is, just for the sake of time, because we have gone on so long, is that I'll post some resources to this. We've done Mozzie's before, which is one of our questions, and Deb has some awesome resources about food as well. So Emanuela, you have asked about foods to start with a 5-month-old. Now, what's really important is go to Deb's Instagram. She has got some fabulous resources there, particularly on iron-rich foods as well. So I will pop a link to Deb's Instagram, or you can just go to her handle, which is at Dr. Deb Levy. So have a look there. And now, anything else that you want to cover before we finish up, Deb?
I think there's one thing I want to cover. Emily's question. Do you see?
Okay,
that's quite a long one, but thank you everyone for watching us live and sharing and asking questions. But so the reason I want to bring this up is I'm just happen to be seeing a lot of it at this moment in time. Emily, I'm not sure where exactly you are from in terms of north or south, what country, because it kind of depends on the answer that I'm going to give. But the reason being is that this time of year, a lot of children can feel a little bit off kilter because there's a lot of change that's often happening. So, change in classes, change in schedules, change in, what's coming up with the holidays, so that can be very unsettling for some children. The other thing is that I don't know how you're feeling, Sarah, but I'm feeling this mad energy at the moment in Sydney. where
It's
people are rushing everywhere, cutting people off in traffic. And the number of near accidents that I've nearly seen, people running into traffic, I mean, like mad stuff. And I think it's just that energy of the end of the year when everyone's it's like that mad fury to the end, you know. And I think that children do pick up on this, and certain children are more sensitive than others. And, you know, often it you know, they're not wanting to go to daycare or school, or very upset at drop off. You know, to me, that indicates to me that maybe your child is just feeling that they need a little bit more downtime, a little bit more connection, and to feel a little bit more secure in their environment. Obviously, I'm generalizing. Obviously, I don't know your son, you know, but I'm just trying to, you know, reflect on other experiences I'm having at the moment, both in my home as well as what I'm seeing with my patients. So, you know, wonderful to be so in tune with your child. And sometimes it's just a case of making them feel more secure. And, you know, when it comes to that separation and that separation anxiety that children often get, there's a book that I often recommend that I find is wonderful, and that's called The Invisible String. I don't have any royalties from it. It's a beautiful book all about how even, and you read it with your child, and even how when you're not together, the love connects you by an invisible string, which I think is a beautiful thing beautiful vision to give your child.
Yeah, fantastic. That's, oh, what a lovely note to end on today. That is, thank you. And thank you everyone so much for submitting all of your questions, not just now, but throughout the year. That is our last Mother Doctor Nurse for the year, which is very, very sad, but we will be back again. Don't you worry about it. And we've got something very exciting that is coming next year.
We do.
Well. And so we will let you know about that. We are going to be doing a podcast, aren't we, Deb?
100%. It's all in the process of production right now. So, yes.
Yep.
We'll still be answering your question, but the important thing to say is that we're still actually going to be answering your questions here on, you know, Instagram, Facebook, YouTube, wherever. Sorry, not Instagram, but Facebook, YouTube, wherever you're listening to us from, because we will still do it in this format. But also, you know, I know that I got my AirPods now. I love going for walks with my dogs, listening to things. So, you know, hopefully we'll be able to help more people that way.
Yeah, absolutely. And we will let you know all of the details with that when we can. So thank you for joining us. Have a happy and safe holiday season. And we will see you again next year, 2023. Thank you all for joining us, everyone.
I know, crazy. Happy New Year, everyone.
See you.